and then you have just to select the proper level. So now, what about the arterial danger zone? This is very, very important before we inject. My colleagues will inject now the upper face, the mid face, and the lower face. So now this is very important to understand the arterial danger zone. The face is a network of vasculature. If we look, this is our face. It is a network. It is not a very clear little pathways of arteries. But at the end, it means that in every area we might have some bruises. Yes, I can understand it. But the main structure of the arteries, which might cause severe vascular damage, should be excluded from our way of injection. So what are the main branches supplying the face? The main branch is the external carotid artery. And these branches are the branches of the external carotid, superficial temporal artery, maxillary artery. These are the two main branches. We have then the facial artery, we have the infraorbital artery, and we have the transverse artery. So we have to know where these arteries are, what are the landmark, and what is the level of the pathway of these vessels in the face. The second way, the second main branch which supplies the face is the internal carotid artery, and these are the main branches: supraorbital, supratrochlear artery, we have the ophthalmic artery, and dorsal nasal artery. As you can see that this artery is supplying the upper part. So simply, when I'm talking about which area will be supplied by internal carotid or external carotid, this is the main supply of our face. This area, I sometimes call it the mask area. You know, the mask, you can put it during parties and so on. So this area is supplied by the branches of internal carotid arteries. And then we have to understand that we have anastomosis between the external branches and the internal carotid branches. And this is the main issue. Because the main issue here is the ophthalmic artery. And this is the most dangerous artery, and the most dangerous complication is when the filler reaches the ophthalmic artery, because it will lead to major vision problems. So, we have to know first the facial artery. When I'm talking about the facial artery, we have the typical branches. From down to up, we have inferior labial artery, superior labial artery, we have the alar artery as the nasolabial area, we have the lateral nasal artery, and then it ends as angular artery. And sometimes this angular artery will pass into the forehead, forming what is called paracentral artery, as I will say later. So now first, what is the relation, what is the depth of the facial artery in relation to the bone, to the muscles, and to the fat? Because when we understand the pathway and the level, we can decide where I have to inject my filler. So, this is the muscles of the face. This is almost the facial muscles. And this is the pathway of the artery. As we can see, the clear whitish area, this area is the areas where the artery is little bit superficial. It means it is in the subcutaneous level. So when we inject in this area, you should be very careful not to inject superficial. And if you have to inject superficial, you have to use cannula. You have to. It is not an option. So we have variations? Yes, we have variations. And as you can see here, we have this kind of variations that the facial artery stops at the superior labial artery. So what will be about the upper part of the face? Which artery will supply it? So this, when we have hypoatrophy of the facial artery, this area is supplied by infraorbital artery and the dorsal nasal artery. And this is present in about 20% of cases. It means you have to take care when you inject simply the nasolabial fold in its upper part. It is supplied by infraorbital artery. And we have here in the upper part, also in medial side of the cheek, we have the dorsal nasal artery. If you inject in this artery, we will have a major vascular problems. So always will be again and again about the depth and level of injection. Another pattern, that the facial artery, when it goes up, it doesn't go to the normal pathway as angular artery. We have what is called the detoured artery. It is just vertical, not oblique. So simply in this case, we call it detoured facial artery. It follows the vein. And now, where will be the landmark of this straight facial artery? This straight facial artery is present in around 25 to 30% of cases. It means third of cases we have the facial artery doesn't go oblique. It goes up and then it goes toward the nose. So sometimes when I ask someone, you inject here, yes, are you afraid from the presence of the facial artery? He tells me, no, the facial artery is so medial. And I tell him, no, I'm sorry. In 30% of cases, when you inject lateral, you might hurt the main facial artery trunk, because in 30% of cases, the facial artery present in a vertical way, not an oblique way. So how we can know? To know the detoured facial artery, it will follow the course and the pathway of the facial vein. Simply, both of them started from the anterior border of masseter. When just you, لما نجزوا على أسنانكم, clench your teeth, you will feel the anterior border of masseter. The first structure in front of the masseter is the facial vein. And in front of the facial vein, we have the facial artery. So simply when it goes up together, the pathway and the landmark will be the same. So this landmark now is for both, for the facial vein and facial artery detoured branch. So it is in a line starting from the anterior border of masseter till the inner cancers. This is how the facial vein course will go. The same for the vertical types of the facial artery. So simply, how we can know it by landmark? We are not a surgeon, we are dermatologists. So simply we have to know where will be landmark from the external surface of the face. Simply ask the patient to clean her teeth. This is anterior border. My thumb goes up to the inner cancers, like that. So I put a point here, I should not inject at this line, because we might have the vertical branch of the facial artery. Now let's start area per area. My colleagues will inject within half an hour the forehead, the temple, the mid face, and the lower face. When they will inject, they will select a level of injection. And why? Because we have to know the structure and where is the level of this structure, so they have to change the level of injection depending on the presence of these main arteries present. So what about the forehead, the eyebrow, and the glabella? Which arteries we have in this area? We have the supraorbital and supratrochlear. So from where these arteries will come? You know the mid-pupillary line. Just medial to it, we have what is called the medial limbus. At this line, we have three foramina in a straight line. At the supraorbital margin, we have the supraorbital. Just below the inferior orbital margin by 1 centimeter, we have the infraorbital foramina. And down the chin, we have the mental foramina. So, at this area, you have to know we have two main arteries. The arteries coming out from the foramina is supraorbital, and just medial to it, we have the supratrochlear artery. These are the supratrochlear medially, and this is the supraorbital artery. This is a pure anatomy of it. So now, where will be the landmark of this artery? One landmark, it's very simple.